The Quo Podcast. Change your way.
Welcome to the Quo Podcast. I'm Ali Havas and I'll be hosting this episode. Today we're going to look at the impact of the COVID-19 pandemic on sex workers. Even in 2020, sex work remains a highly politicised, contested and stigmatised space. It's now decriminalised in New South Wales, which empowers sex workers to negotiate with clients and report violence without a fear of arrest. This is different in places where sex work is legal. In these cases, laws still control where, when, and how sex work can take place. This alienates workers who don't comply with restrictive legislations. So joining us today are two prominent voices for the community. Gala Vanting is a writer, sex worker, and advocate. Today she represents Scarlet Alliance, the national peak body of sex workers and sex worker organisations in Australia. Tilly Lawless is a queer, Sydney-based sex worker. She uses her online platform to speak about her personal experiences and to shine light on the everyday stigma that sex workers face. There's often this real disconnect between how people imagine sex work and the realities of the profession. Tilly, could you give us a sense of what the reality of a typical working day or night looked like for you before COVID-19?
So a typical day for me, I worked night shift for many years, and when I did night shifts, I used to work from 8 p.m. till 4 or 6 a.m. These days I work day shift, so I go into the brothel at 10 a.m. and usually work till about 6 p.m. and I might see between 4 to 12 clients in that time, but most of the day is really spent in the girls' room with the other workers on that shift, and I work 3 or 4 shifts a week.
So it sounds like there's a real social aspect there. What about you, Gala?
I guess I'm sort of a freelancer, so I work independently, which means that I arrange my own bookings and I kind of make that schedule myself rather than working shifts. And so a typical day for me might only be admin or cleaning or other things that, I guess administrate the business. But, in a typical week pre-COVID, I might see between 1 and maybe 6 clients, depending on how it's going for me. And at the moment, I see exactly 0. So it's a pretty big drop.
That's a lot. So, Gala, today you're talking to us as a representative of Scarlet Alliance. Could you tell us a little bit more about the organisation?
Sure. So Scarlet Alliance is the Australian Sex Workers Association, and that means that we are the peak body representing sex workers and sex worker organisations in Australia. And look, our aims are really to promote the health and human rights and labour rights of sex workers. And I guess that, that can take a lot of different forms. We're a national peak, so we do a lot of advocacy at the national level in terms of things like sex work law reform, fighting for anti-discrimination protections, representing sex worker interests in media and on, government bodies. So we work in a lot of different spaces, but our main aim is the unfettered human and labour rights of sex workers.
Linked to that, I read on Scarlet Alliance's website that sex workers have taken a significant hit in income during the pandemic. But unlike people in other professions, it's often really hard to get on government support schemes like JobKeeper. Tilly, have you managed to access JobKeeper so far?
Well, I started the process, and I actually probably could have accessed it because I am registered as like a sole trader and I declare my income. So my accountant could have written a sort of like loss of income like letter for me, and I probably could have got on it. But I started doing online work, and I'm now making too much in online work to, like, I'm above the threshold of being able to get any sort of job seeker or job keeper payment. I get the two of them confused. So yeah.
So we'll delve into online work a little bit later. But Gala, could you tell us a bit more about why sex workers are having difficulty in accessing government support and how policies could change to make it easier for sex workers to access the support that they need?
Sure. So I think it depends on the type of support that you're after, but I think what COVID-19 has really amplified is the lack of equity for sex workers in attempting to access all kinds of government supports and services. And I think that the things that impact that the most are stigma and discrimination. Sex workers have reported, historically negative experiences dealing with things like the DHHS and people working in Centrelink offices when they disclose their profession, or if they choose to disclose their profession, they may not be seen as doing real work, for example. And I would be very surprised and very happy to meet and someone working in a Centrelink office who saw sex work as a legitimate profession that could be that fits into the job seeker scheme. I think we also are quite concerned. We have a lot of privacy concerns around disclosing our occupation to a government body. We don't really have any strong securities regarding how that information might be used, both by the Department of Health and Human Services and by other departments with whom they communicate. So I think that's just, right at that point of contact, there are a lot of barriers already in place. And that's something that sex workers have definitely noticed. The relaxation of documentation requirements for the job seeker scheme that came as a result of COVID-19 were a positive thing for some sex workers because a lot of us we aren't able to provide a letter from the brothel that we were previously working for to show that, we were dismissed from that role or that we left it or whatever. There are a lot of things that we aren't able to provide because we are a more informalized economy. We're often working as subcontractors or sole traders. So I think there's lots of ways that we fall through the gaps of those systems.
And it sounds like it's very related to the stigma that still exists around sex workers, like if it's very much to do with individual, people at Centrelink on that individual scale as well as the wider policy level as well.
Yeah, I think that stigma takes place on a very personal micro level and also on the macro and systemic level. And I think we also, because we in most states do not have anti-discrimination protections, there's no real security for, if we have a negative experience, there's not a lot of options for mechanisms for redress for us.
There really needs to be more opportunities for redress. So Tilly, how has COVID-19 personally impacted upon your life and your earning potential?
Well, the first week when they announced, I think it was the end of March when they announced that brothels were going to close, I was in a complete panic because I have done brothel work for 7 years, and whilst I occasionally do private work, like 80% of my income is brothel work, and so I was in a complete panic. And there was no intimation of like when the brothels would reopen. Like I had also had no idea at the time if I'd be able to get on like Job Seeker. And it was just like, it was also just like, it was like, everyone was just like, do we go interstate and work somewhere else? Like, do we immediately set up private work now? Like, will private work be illegal? Like, no one had any idea what was going on. So that like first like initial week of the brothels closing was like truly stressful. And it's also just very stressful to have a job that you relied on for 7 years just fully taken out from like under your feet with like no warning. But since then, I've started doing online work, which is like something that, I'm really lucky to be able to do because like a lot of sex workers can't transition to it that easily because there are a lot of risks in terms of like your identity being exposed. Like, because for example, I'm using say OnlyFans, and like that's a website that to sign up for, you have to like provide your ID because you need to prove that you're not, like an underage person creating what would be like child porn. So they take your ID, and like OnlyFans occasionally gets hacked, and people's like, legal names get released on the internet, and then everyone knows that they're doing a form of online sex work. So a lot of people, it's like not possible or like viable to be online, or they just might not have access to the kind of technology you need to be online, like whether it's like for camming, like a good working laptop or like whatever. But I've been really lucky in that I've transitioned to online work, but I'm not making as much as I would from brothel work, and I really don't enjoy it, and I would really like to know when brothels are going to reopen, but like obviously we know that they've just said in like the stage 3 restrictions when they begin to lift them that brothels and like strip clubs are going to remain closed. So like who knows when brothels are going to open.
So for those who don't know, can you tell us about what OnlyFans is and the kind of services that they provide?
Yeah, so OnlyFans is a subscription based platform where you can set a subscription price between, say, I think it's between like $4 you said to like $45 you said a month, and people you set your own price, and then OnlyFans takes 20% of what you set, and people can subscribe to get access to your content, and then you can sell extra, like you can sell videos per view and stuff like that. Like you can make money in extra ways on it. And I've been making like just kind of like quite like vanilla stuff because I tend to be like more of a vanilla worker anyway. Like I'm kind of classified as GFE, which is girlfriend experience. Like I tend to just do a really basic service. So I've been reflecting that online. Like I've been doing just like videos of me masturbating and like like a video of a friend of mine fucking me with a strap on, like things like that, and then I can sell the videos. Yeah.
And are you leveraging, because you've got quite a significant online following, at least on Instagram, and you're quite a significant voice for the community, are you leveraging that to advertise?
Totally. I would not be making, like, OnlyFans has been fairly successful for me, and that's only because I already had a platform and a following. Like, I've slowly built up my Instagram following over, like, something like 7 years or whatever it is, and now I'm, like, monetizing it through OnlyFans, and I'm well aware that a lot of people who started camming or OnlyFans or any sort of online work in the aftermath of brothels closing would not be in the same financial position I am in of stability because they don't have the following. It is quite complicated though because like Instagram will. Are you still there, by the way?
Yes.
Oh, good. Sorry, my screen went black, so I'm like, I just want to make sure it's still recording.
Yes, it is.
It's really complicated though because like Instagram will kick you off Instagram if they find out you have an OnlyFans because when it comes to like basically promoting or soliciting any form of sex work, Instagram will delete your account, and OnlyFans will delete your account if they find out you're a sex worker, a full service sex worker in real life, because they don't want it to be seen that they're promoting prostitution. So it's really weird. Like I like with both platforms, I have to be like very careful in what I reference, and it's like it's so weird and like sadly ironic that like OnlyFans will like make money off me selling videos of me masturbating, but like they'll shut down my account if I mention that I will meet people in real life and be paid for sex. Like it's like so hypocritical and bizarre.
That is bizarre. I just wanted to touch upon something else that you said earlier on. You said that you're very much looking forward to brothels reopening. So why do you personally kind of enjoy the face-to-face interaction of real-life sex work compared to working on a platform like OnlyFans?
I like having a clear delineation of when I'm working and not working. Like at a brothel, you have your shift time, and that's when you're at work, and the rest of the time you can just do whatever the fuck you want to do. At the moment, I'm like always replying to like people's messages on OnlyFans, and there's just so much admin, as like Darla would know from like private work, and like it's just I don't enjoy it. And I miss working with other women. Like most of the time at the brothel is like in a room with like sometimes 10 other women, like chatting to them, and I really miss that. I find online work quite isolating. I'm also constantly concerned about having my account shut down because I know I'm violating kind of both terms of services on both websites, just by virtue of who I am. Do you know what I mean? Like I'm violating Instagram's terms of service by being an out full service sex worker. Like OnlyFans the same. So like it's kind of stressful. And yeah.
That's really interesting. Well, Gala, just from the perspective of the Scarlet Alliance, and also your own personal advocacy work. I remember listening to you at Queer Thinking earlier on in the year, and you were talking about face out sex work. So do you think that these digital alternatives to face sex work are kind of problematic in terms of who are able to access them and the kind of privacy concerns associated with those platforms?
I think that in order to put an image of yourself on the internet as a sex worker requires a few privileges that not all sex workers have. So I think that and we have a lot of sex worker privacy concerns in the digital space in the same way that we do in things like, accessing Centrelink or accessing health services and those sorts of things. So I guess I see it as I don't know if I would call it a problematic space. It's a work venue like all other sex work venues, but there are definitely access barriers to that. And I think that, for those most marginalized sex workers in Australia who perhaps don't have access to the technology required to use those platforms, who are not able to offer state-issued photo ID to a platform like that for any number of reasons, whether that be, their migration status, their age, maybe they have concerns about their family situations, have been through a family court situation, and are hesitant to disclose their sex work status to anyone. And I think that, also like Tilly has described, those businesses are not necessarily the most trustworthy, or they don't have the best interests of sex workers at heart. So offering over such personal data can be, I think, pretty daunting for a lot of people. And Tilly mentioned, that's a risk that they were able to take, but that's not, that is something that not everyone can do.
Yeah, I think there's the real risk that many people outside the sex work community are guilty of homogenizing sex workers. So I wanted to ask you, Gala, what are some of the challenges faced by sex workers at this point, especially more marginalized sex workers like migrant sex workers, LGBT plus sex workers of color? I
think that generally speaking, more marginalized people are always going to bear the brunt of something like a public health crisis. And I think we've seen that pretty well evidenced in the COVID situation. For us, there's a massive gap in the income support question. And we talked a little bit about that earlier. Scarlet Alliance has ended up having to, in the absence of meaningful government support for a lot of our community, we've had to raise those funds ourselves, and have been doing a community fundraiser for, I think, maybe 5 or 6 weeks now, where every week we raise as much funds as we can, and then we drain that funding account to the applicants who come through. And look, the people who are applying to get those funds are people who cannot access any other forms of income support. And what we're able to provide them is nowhere near what they should be provided by payments like JobSeeker and JobKeeper. And Scarlet Alliance has lobbied the federal government multiple times throughout the COVID crisis to provide this kind of support. We've asked for direct support to our organizations, which we can then funnel directly to sex workers, because our sex worker organizations have the highest level of contact with sex workers in Australia of any other organization. So we really are able to deliver that funding to the people who most need it. And that's what we're working on now. We just would really like to have a lot more funding to work with, because the need far outweighs the available resources at this point.
So I was going to mention this at the end, but for our listeners, how can they support Scarlet Alliance's fundraising drive?
Yeah, so we're running a Chuffed.org campaign to raise those funds. And if you Google Chuffed.org and Scarlet Alliance, you'll find it easily, or you can find it in the show notes for this episode.
Great. I think that's something that's pretty overlooked, and something that more of us non-sex workers should donate to. Tilly, I wanted to ask you, do you feel like Corona has impacted on your feelings of community and solidarity with fellow sex workers?
I don't know if it's impacted on my feelings of solidarity and stuff. Like, I feel like I already felt like a great sense of like connection and community with a lot of the women I work with, and I still feel that, except now it's just you have this bizarre thing when you have this, like, at brothels you have this accelerated intimacy with other people you're working with, and you don't even know their real name. So there's so many women that like I think of now, and I'm like, I wonder how they're going. Like, I wonder if they've been able to get another job, or if they've been able to get on like Job Seeker or whatever, and I just don't know anything about any of them or how they are, because there's no way to contact them and I don't know any of their real names. So like that's a really bizarre thing for me, is like having spent, you know, day in and day out with these women for like some of them I've known for years and years, and it's just like I just don't know how they're going in their lives, and like I would love to be able to reach out and help, and there's just no way, especially with the migrant women that I work with, because I've worked with like a lot of migrant women, and them especially I'm worried for, because a lot of them aren't citizens, so definitely wouldn't have access to like government support, and I'm just like, I just can't even check in on them. So that's bizarre.
Yeah, that must be really alienating. For the friends of yours who you do know, do you use your Instagram as well to kind of leverage support for the work that they might be doing on OnlyFans or other digital spaces at this time?
I've posted Scarlet Alliance fundraiser a few times. I'm careful about promoting people's OnlyFans. I have promoted a few friends, but I have to be really cautious because it can get my Instagram shut down promoting OnlyFans. So, and it can also, you know, just like promoting sex work in general can get an Instagram account shut down. So I can't promote people's things as much as I would wish.
Can I come in on the question of isolation?
Oh, of course. Yeah. Yes, of course.
So, like Tilly mentions, there is a sense of camaraderie and communication that exists in sex service premises or sex industry workplaces that really can't be replicated elsewhere. And the brothel or the massage parlor or the strip club or whatever might be the only place where a sex worker is able to be out to other people. And the health implications of isolation from those peer networks are really significant. And this is why we find it so problematic that the federal government roadmap has specifically continued to close brothels and strip clubs in stage 3. We know that in order for sex workers to share information with one another about how to stay safe and healthy at work, how to adapt their working practices to the COVID crisis, all of those things are shared in sex industry workplaces. And for sex workers who are not connected to a peer organization or to another digital peer network, they are getting none of that information at all, which is actually a higher risk because they don't have access to that peer education, and that has very negative health consequences. The work that we did as sex workers around the HIV/AIDS crisis in Australia really modeled this behavior, and it's fantastic evidence for why we should be able to continue to work and make contact with one another and adapt our practices to the new situation.
So I feel like a lot of what you've said really touches upon this idea of harm reduction in sex work. Could you elaborate a little bit more on harm reduction, especially in the context of the pandemic and for sex workers day to day?
So I guess the first thing to think about or to refer to in this discussion about harm reduction is that sex workers are a part of the community, and sex workers are just as invested in flattening the curve, quote unquote, or in ending transmission or reducing transmission as all other members of the community. And I think that's something that has really been neglected and forgotten by the federal government in their roadmap. Sex workers have been adapting to COVID since well before industry shutdowns and other public health orders started to take place. And that included things like adapting our services, moving them online, going towards phone sex, and like those kinds of distance services, sexting, sexy emails, content production, all of that kind of stuff, doing social dates instead of sexual service bookings. And we've also, I guess, we've made improvements to our cleaning protocols and hygiene protocols, but those were already pretty strong because cross-contamination and transmission risk and those kinds of things are actually just a part of a sex worker's everyday work. So this is something that we were already doing and already very good at. So there's been, I think, a lot of adaptation, and there's been a lot of resource sharing in the name of harm reduction. And I think that we have seen really great results from that, and will continue to do so as long as we're able to connect, to adapt, and also to collaborate with governments on making the plan for all sex workers to return to work.
Yeah, so I guess the way that the harm reduction discussion is framed is also kind of linked to stigma faced by sex workers. So do you think that the pandemic has impacted, like increased the pre-existing stigma faced by the industry?
I think that the pandemic has, look, sex work stigma is rampant and with us at all times, and so it kind of doesn't matter what's going on in the world. It just exists as a baseline condition of our existence, and no one knows that better than sex workers themselves. But I do think that the pandemic has located, that stereotype of a sex worker as a vector of disease. And actually, Tilly made some really great social media posts about this a few weeks back. A lot of those stigmas are reinforced despite the hard evidence that sex workers have lower rates of STIs and BBVs than the general population. We have an extremely high uptake when it comes to condom use and safer sex. And we hold a wealth of knowledge about those things. So yes, I think that stigma has reared its ugly head yet again. And I think that, the work of Scarlet Alliance and our allies is to debunk those myths and to talk realistically and with an evidence base about how sex workers fit into the infection control.
And Tilly, can you speak to that from a more personal perspective? Have you, obviously stigma is a baseline, have you noticed any kind of increases in stigma in the last 2 months or so?
I think, as Gala said, the stigma has always been there. I think people are just more aware of it. And by people, I mean non-sex workers, because they're seeing, in the stage 3 restrictions that saunas are allowed to open, but brothels aren't. And I've spoken to, for example, a number of my friends about in Victoria, a $20,000 fine was brought in for anyone who does a sex work job, which is just obscene. I would understand if they brought in a $20,000 fine for anyone who does a Tinder date. Do you know what I mean? If they were bringing it in across the board for anyone having sex outside of their home, I would understand that. But it's just blatant stigma when it's being directed specifically at sex workers. And I just wanted to say something, because when you guys were talking earlier, it was making me think. Before the brothels closed, the brothel I was working at was bringing in a few different sort of harm reduction strategies because of coronavirus. And I mean, brothels are fucking smell of sperm and hand sanitizer. If you've ever been into one, you would know, because you're constantly using hand sanitizer and cleaning the showers between bookings and changing the sheets and whatever. But some of the things that they brought in was we were no longer allowed to be in the girls' room. We had to have our own brothel room for the day that we worked from, so there was less cross-contamination, and so that we weren't in the same shared space with aircon and circulated air. And the other thing that they did was they had one of those temperature guns, and they checked every girl and every client's temperature before they were allowed inside the building. And obviously that's not foolproof, because someone can have coronavirus and not have a temperature, but it is an example of, I didn't hear of other workplaces doing that. Do you know what I mean? But yes. The brothel was ahead in terms of public health stuff. But brothels are never given it the benefit of the doubt in terms of being on the ball with public health stuff, but a lot of the time they are. Yeah.
In terms of not being given the benefit of the doubt, I feel like a lot of people often forget that there are lots of positive experiences that people have with sex workers. I'd love to hear about some of these positive experiences that you've had as a sex worker with a client that have stayed in your recent memory.
Yeah, I think probably one of my favorite client stories is this client I was seeing for years. Probably saw him for 4 or 5 years. A middle-aged guy, and I first started seeing him when he and his wife divorced, and we got to know each other really well over the years. And he 2 years ago started dating a Chinese migrant sex worker that he met at another brothel, and they're now married and having a child. And allows her to, he's comfortable with her working. And so she still does sex work. And he has said to me that he, without having like interacted with me and like coming to understand, like, you know, because I always spoke to him about like my girlfriends and like what was going on with my love life. And he was like, through you, I came to understand that it really is a job and that you can have like an entirely separate romantic life and it doesn't affect your romantic life. And he was like, I would never have considered dating a sex worker if it wasn't for you. And I would definitely never have like, considered allowing her to continue working while we were married and like trying for a child. And like I think about the fact how I've changed not just his life but her life, you know. She's like, you know, a Chinese migrant woman who now has citizenship through him as his wife and is able to continue working in the job she wants to work in, and like have his support. And I'm like, and that all came from him having nice interactions with me. Like, so that feels really special to me.
Yeah, that's like a transformative experience for, well, I guess, all three of you.
Yeah, exactly.
Yeah. Gala, would you be open to sharing a positive experience you've had?
In general in sex work or like COVID specific?
Well, yeah, COVID specific would be interesting, but in general, just something that has sort of stayed in your memory, something that as you know, a positive and transformative, it doesn't have to be transformative, but just a positive experience.
I mean, I think that there's been lots of sex workers complaining on Twitter about all the clients who text us and say, oh, I'm so sorry about all that's happening in your industry, must be really struggling, and, you know, like giving these like kind words that often require emotional labor from sex workers, and are less supportive because of that. And I've certainly had my fair share of those, but I've also had, I have one client in particular who said some of those things, but also sent me some Coles vouchers so that I can buy food. And that's the kind of support, you know, that I think is really useful for sex workers right now. Like there's, you know, we can talk about it all we like, but the most supportive act you can take is actually monetary at this point. I know that's not accessible for everyone, but if it's not accessible for you, push it towards the people who it is accessible for.
I'm sure lots of our listeners are interested in learning more about the work that you're both doing. So where can they find you?
You can find, the best way to contact me is Tilly_lawless on Instagram. That's pretty much the only social media thing I reply to. And you, Gala?
So I can be found at Galavanting on most platforms. Sometimes there's an underscore, just Google it. Galavanting.info, and Scarlet Alliance can be found on scarletalliance.org.au and at Scarlet Alliance on Twitter and Facebook.
Tilly and Gala, thank you so much for your time today. It's actually my first time hosting a podcast. So I think you've been really patient with me. This conversation gave me some really interesting insights into the experience of sex workers. And it's not something I necessarily know a huge amount about, but I'm very curious, and I'm sure that's, you know, the position that a lot of our listeners are in. I think it's great that we're having these discussions. It's not something many people outside the industry think about or even talk about. So thanks again for your time.
No worries.
Thanks for having us.